Hello.
Hi.
How are you today?
I'm doing good.
Good. My name's Marley. I'll be examining you today, if that's all right.
Yes, ma'am.
Okay. Can you tell me your name and your birthday?
My name is Emeline Carrera.
Okay.
And my birthday is 5/28.
Okay. All right. Miss Carrera, what makes you come in today?
I'm just here to establish care. I'm new to the area.
Oh, okay. Alrighty. Well, are you having any complaints today? Any pain?
No, ma'am.
Okay. All right. Well, if I may go ahead and get us started on the assessment, if you don't mind.
Yes, ma'am.
Okay, so I'm going to first start off with some vital signs, okay?
Okay.
All right, so I'm going to get a blood pressure, get an oxygen level. Do you have any breathing issues, any blood pressure problems?
I have history of asthma.
Asthma, okay. How long have you had asthma?
Well, a week ago, I had an asthma acute exacerbation.
Oh, okay. Did you have to get hospitalized for that?
I just went to the urgent care and they just gave me some steroids.
Okay. They didn't give you any kind of breathing treatment?
Well, no, I already have it at home, so.
Okay. I'm gonna get a blood pressure real quick and then we'll talk about that more.
Yes, ma'am.
Well, your oxygen level looks good. Your heart rate looks good. Okay. Do you normally have high blood pressure?
No, ma'am.
You just get nervous around healthcare providers?
Maybe.
Okay, all right. Well, we'll look into that further. But just for right now, what makes you come in? Oh, no, excuse me. You already said that. I'm sorry.
Okay.
Well, I got some other dumb questions. Can you tell me what year it is right now?
It is 2025.
Okay. And can you tell me what month it is right now?
It is April.
Okay. And can you tell me what place we are in right now?
We are in the Christus Trinity Mother Francis Clinic.
Okay. Does any of your family have any history of high blood pressure, any blood pressure problems?
My parents.
Your parents have high blood pressure? Both of them or just one?
Well, both of them.
Okay.
They have maintenance.
Okay. What about your grandparents on both sides?
Maybe. Oh, maybe. But
Okay.
I know for sure my grandmother from my mother's side.
Okay.
Because my grandmother from my mother's side is still alive.
Okay.
But then my grandmother from my father's side, I don't know. She's
Okay.
gone.
But you've never been diagnosed with high blood pressure?
No.
Okay. And you don't take anything at home for your asthma? This was just abrupt within the last week?
Well, I have as needed inhaler
Okay.
and nebulizer.
I presume it's albuterol? Is that
Yes,
correct?
correct.
Okay. Okay. How often do you use it?
Well, last week I used it often,
Okay.
like every 6 hours is needed,
Why so?
because I'm wheezing because of the seasonal allergies of the pollen.
Oh, okay. Okay. Are you allergic to anything?
Pollen.
Pollen. Okay. What about any food
And
or medication?
medications, Aleve and Advil.
Aleve and Advil. What does Aleve and Advil do to you?
Makes my eye
Swell up.
swell, have rashes, wheals, and it's just itchy.
Okay. All right. And do you take anything for that whenever it happens?
If it happens, I'll take Benadryl.
And the Benadryl helps?
Mhm.
When was the last time you took Benadryl?
A long time
A
ago.
long time ago. Okay. Okay. So this hasn't happened in a long time.
No, because
Okay.
I prevent myself from taking those medicines.
Okay. All right. Well, I'm just going to start an assessment if that's all right. I'm gonna go from head to toe. So real quick, I'm just gonna go grab some gloves and I'll be right back and we'll start with your scalp. I see that your eyes and your eyebrows, your eyelids, your nose, and your mouth and ears are all symmetrical and even. Okay. I don't see any evidence of skin breakdown, any lesions or anything like that. I don't see any evident masses, no indentation. Okay, I'll go grab those gloves just real quick, and I'll be right back, and I'll start with palpating your scalp. Okay?
Okay.
Give me just a minute. Alright. I'm gonna do some hand hygiene here first. Any other issues that you've ever had?
No, ma'am.
Anything like diabetes or anything like that?
No.
Okay. Alrighty, no heart problems, no lung issues other than asthma, COPD.
No.
You don't wear oxygen at home?
No, ma'am.
Okay. Alright. So, we're going to start off with palpating your head, your scalp. I don't see any areas of baldness. And like I said, I don't see any masses. So, I'm just going to palpate. I want you to let me know if it hurts at all or if it's tender anywhere, okay? So, here we go. Any tenderness anywhere?
No.
Okay. I'm going to do it one more time just for good measure. Okay, I don't want to mess up your hair. There we go. All right, so from there, I'm just going to assess your eyes, your ears. So I see that your pupils are round and equal. See your sclera is white, no evidence of jaundice or erythema. No eyelid swelling is what I see here too. Okay, so let me go ahead and look at your pupillary response. I want you to stay looking at my nose, and I'm going to shine a light in your eyes, but stay looking at my nose, okay? All right, and then the other side, stay looking at my nose. And they are responsive. Okay, so next I'm going to check accommodation. So with this pen, I want you to follow this pen with your eyes. Wherever this pen goes, I want you to follow with your eyes, okay? And here we go. Very good. And keep on following. Here we go. Alrighty, your extraocular movements are good. Alrighty, so now I am going to, let me go ahead and assess your sinuses. Let me know if there's any tenderness as I palpate. That was, okay, the frontal sinus, that was, I'm going to assess your lacrimal apparatus there. Any tenderness as I press?
No.
Okay, I don't feel any swelling. Next, I'm going to do the maxillary sinus. Let me know if there's any tenderness. Any tenderness as I press? Mm-hmm. Okay, very good. So let me look at your nose here real quick. I don't see any evidence of a deviated septum. Just going to look in there. No polyps, no lesions, no bleeding. Okay, very good. And so now let me go ahead and look at your mouth while I'm here too. Tongue is pink. No evidence of lesions. Can you lay your tongue down just a little bit? Just relax it. I see your uvula is midline. Say that one more time. Okay. Let me do this here. I'm just going to assess back here. Okay. Let me do your gag reflex. Here we go. Okay. Okay, I'm so sorry.
Okay.
I'm so sorry. All right, so I didn't see any dental caries or anything like that. Okay. So, real quick, I want you to close your eyes. And I'm going to test your olfactory cranial nerve. I want you to tell me what you're smelling here.
Peppermint oil?
Yes, ma'am. That's correct. Okay, you can open your eyes. So, if I can have you now, occlude one nair, one nostril, and just breathe in and out of that left nostril right there. Very good. And then occlude right there. Very good. Okay. You don't feel any kind of blockage or any issues?
No, ma'am.
Alrighty. So I'm gonna go ahead and look at your ears. I don't see any evidence of skin breakdown on your ears. And what about that side? Okay, very good. I'm gonna palpate. I want you to let me know if there's any tenderness. No tenderness at all. Okay. With your right ear, can you occlude it? I'm gonna whisper 2 words in your left ear. I want you to repeat after me, okay?
Apple pie.
Okay. And then can you block that ear? I'm gonna whisper something over here. And here we go.
Strawberry banana.
All right, very good. And so I'm going to now test your temporomandibular joint. I want, as I press right here, I want you to just open and close your mouth. And just keep on opening and closing. I don't feel any clicking, any grating. You feel any tenderness as you open and close your mouth?
No, ma'am.
All right, very good. Okay, so let me go ahead and palpate these lymph nodes. There's the preocular. That feels good. Your mastoid process feels good too. No post-auricular issues, no swelling. There's your occipital lymph nodes, no swelling or issues. All right, I'm gonna come right here to the submandibular. I don't feel any swelling of those lymph nodes. And then the submental, no issues or swelling. I'm gonna go down this post-cervical chain here. Feels good. No tenderness on all this, correct?
Yes.
And then the supraclavicular lymph nodes, and then the infraclavicular lymph nodes. Same on this side. Cervical chain, lymph nodes, supraclavicular lymph nodes, infraclavicular lymph nodes. All right. No pain, no tenderness with that, correct?
Correct.
Okay. So I see while I'm here at your neck, if I can have you just turn your head from side to side. Your neck, just at your neck. Very good. No tenderness, no issues, no grating or clicking, right?
No.
Okay. So I'm going to hold my hand up right here and push up against your face. Don't let me push your head to the right. Very good. And don't let me push your head to the left. Very good. All right. While I'm here, don't let me push your shoulders down. I want you to push up. Very good. Very strong. All right. So now I'm going to go to your back and assess your trachea, assess your thyroid that I see is midline. No evidence of deviation, no swelling, no evidence of a goiter or mass that I see, or any swelling. No tenderness as I touched, correct?
Yes.
Okay, if I could just have you scoot back a little bit on that bed. I'm going to come to this side here. All right, so just here on the back, I am going to just assess your thyroid. Any tenderness?
No.
No. Okay, and your trachea feels good. All right. So now what I'm going to do, I'm just going to look at your back here. I don't see any issues of skin breakdown. I don't see any lesions. Have you had any pain in your back here recently?
No, ma'am.
Nothing?
No.
Okay, so first I'm just going to assess your scapula and just palpate right there. Any tenderness as I palpate here?
No.
Okay, let's test this side here. Okay, very good. And just go ahead and palpate here down your spine. I feel that it's straight, no evidence of scoliosis anywhere. Any back issues like scoliosis before? Okay. And then while I'm here, I don't see any issues with any kidney area. I'm going to just lightly palpate on your kidneys here. Is there any pain,
No.
tenderness? What about on this side?
No.
Okay. So, just gonna percuss. I want you to let me know if this is hurting, okay?
No.
Okay. And what about on this side? Any pain?
No.
Okay. All right. So I'll make my way back to your front here. Oh, before I do anything else, let me go ahead and listen to your lungs back here. Take some big deep breaths in and out. All right, very good. I heard clear lung sounds. Let's come back to the front here. Just gonna take a look at your chest. All right, I see even and unlabored respirations. That's what I saw on the back as well. And you never had a pneumothorax or any kind of collapsed lung before? Okay, so what I'm gonna start off with, I'm gonna start off with kind of pressing against your chest. I just want you to repeat the phrase 99 as I go down and press, okay?
Okay.
So here we go.
99, 99, 99, 99, 99.
Right. Very good, okay. And let me go back to the back here. Uh-oh. There we go. And then 99. Again.
99, 99, 99, 99, 99, 99, 99.
Okay. Alrighty, so now I'm gonna listen to your chest here. I don't see any accessory muscle use while breathing, so just gonna listen here real quick. And then on this side. Okay, so now I'm going to listen to your heart sounds. Do you have any heart issues? You said no chest pain today,
No,
right?
ma'am.
Okay, so I'm just going to start off with listening to the aortic, and then the pulmonic valve, and then the Erb's point, tricuspid. All right, and then the mitral. Very good. Real quick, if I can have you just lay on your left side on the bed, I'm going to feel that apical impulse. If you can just bring your arm just like that. Mid-clavicular line. All right. Very good. Okay, so now if I can have you sit right back up, I'm going to look at your upper extremities real quick. I don't see any muscle deformity or skin breakdown. Okay, no issues on your upper extremities. Have you felt any weakness, numbness, tingling in any of your extremities?
No.
Okay, so I'm just going to palpate here. Make sure it's all good. And while I'm here, I'm going to go ahead and assess your deep tendon reflex. No osteoarthritis. I don't feel any nodes, Bouchard's, or Herpin's. What about this side? Let's check that side. No, I don't feel any any tenderness as I touch?
No.
As I press? What about your fingers? None?
No.
Okay. Your fingers are good and warm, good circulation. So I'm just going to feel that brachial pulse there. Very good. 2 plus. Brachial pulse. Very good. 2 plus. I'm going to assess your radial pulses here. Very good. 2 plus. Then I'm going to look at your fingers. Just going to make sure that cap refills less than 2 seconds. Very good on that side as well. Okay, so I'm going to test your shoulder range of motion just real quick. If I can just have you just bring your arms out and up behind your head. Any issues of any kind of grating or clicking, any pain as you move. All right, real quick, while you still have your hands behind your head, I'm just going to palpate those axillary lymph nodes. Oh, I'm sorry. I'm so sorry. You're ticklish. I'm so sorry. All right, let's try on that side just real quick. I don't feel any swelling or anything. No tenderness, right?
No.
I'm so sorry. Okay. Well, I'm done with that part. Okay. So, and I want to go ahead and test your reflexes on your elbows while I'm here. So here we go. Okay, and then let's try on that side there. Wow. Good deep tendon reflexes. Alrighty, 2 plus, I would say. All right, so I'm gonna have you lay down on the bed again. Oh, excuse me, I forgot something. Let's try one more time sitting back on the side of the bed. I need to assess your carotid arteries and to make sure you're getting good blood flow to your brain. That's very, 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 very important. So just gonna feel right here. Very good, 2 plus. Then on this side. Very good, 2 plus. All right, now I'm so sorry. I'll have you lay back down on the bed. All right, real quick, if I can have you just turn your head over to that right side there. I don't see any jugular vein distension right there. And then over on this side to your left. No jugular vein distension. Very good. All right. Now I'm going to palpate your breast. I want you to tell me if there's any kind of tenderness there, okay? I'm going to start light. And then I'm going to go medium. And then deep. Any tenderness at all? No? Okay. What about on this side? We'll start light. And then medium. And deep. How about now? Any tenderness?
No.
Okay. All right. So real quick, if I can go ahead and look at your tummy. At your abdomen. All right. No evidence of distension. No liver or spleen issues or anything like that?
No, ma'am.
Okay, so before I assess those 2 things, I'm going to listen to your stomach real quick. Any constipation or diarrhea, anything like that? When was your last bowel movement?
This morning.
This morning, okay. And there wasn't any black, tarry characteristics to it?
No, and I'm regular.
Okay, and you're regular. Okay, so I'm just
Every
going to listen.
morning.
Okay, I'm just going to listen real quick. Sounds good. Okay. So while I'm here, let me go ahead and listen to your aorta. I want you to take a big breath and then exhale. Alrighty. Then we'll listen to your right kidney. And then your left kidney. I don't hear any evidence of bruise. Left inguinal or iliac, excuse me. And then right iliac. Okay, and then I'm going to listen to your femoral. And then on this side. Okay. All right. And while I'm here, I forgot to listen to your carotid artery. So if I can have you just turn over to your right. And then over to the left. Okay. Very good. So I am going to percuss on your stomach. I want you to tell me if there's any pain anywhere, any tenderness. Any?
No.
Okay. I'm going to do this on your liver, see how, make sure your liver's not enlarged. Okay, so that about right there, stops right there, about right there. So about, okay. And then your spleen. Okay. About right there. Okay. It looked good. I didn't feel any kind of enlargement anywhere. All right, you can bring your shirt down. And we're going to look at your legs. Just gonna uncover here. All right, I'm just gonna let you stay laying down for just a second. So, all right, your legs look good. They look even. All right, and there's no leg shorter than the other. I see even hair distribution, and I see good color appropriate for ethnicity. I'm gonna check for cap refill here. I don't see any cyanosis. That is less than 2 seconds for that cap refill. And while I'm here, I'm gonna go ahead and assess your popliteal. Very good, 2+. And then on this side, very good, 2+. So now I'm gonna assess the posterior tibial pulses. So just back here behind the ankle. Very good, 2+. Then on this side. Very good. All right, and then now the dorsalis pedis. Very good. Good and 2+. Okay, so real quick before we go on to anything else, I'm going to test your hip range of motion. So what I want you to do here, I want you to get this leg and just bring it out. Just bring it out. Lay this leg flat. Bring it out. Back in. And we're just going to raise your hip up. No bending the knee. There we go. Now let's bend the knee and bring that up. Very good. Same thing on this side. Let's bring that leg out. Any tenderness? Any clicking? Grating?
No.
Going up straight. And then bending and going up. Very good. Okay. You never had an issue with any kind of DVT?
No,
any
ma'am.
kind of blood clot in your leg?
No.
Okay. All right. I don't see any skin breakdown on those heels. Those heels look good. All righty. And then now, this is what I'm going to have you do. I want you to push up against my hands. Do not let my hands push your feet down. And here we go. Wow, very good. And then don't let me push your feet up. Push my hands down. Very good. Okay. So while you're laying down, if I can have you do one kind of dumb thing for me. It seems kind of dumb to the patient. But if I can have you just bring this heel to that knee. Go all the way down your shin and all the way back up. Very good. And then on the other side, bend and go up and down. Very good. Okay, thank you very much. So now what I'm going to assess, I want you to get one of your fingers and touch your nose real quick. Touch my finger with that same finger. Then go back and forth real fast. Very good. And then with the other index finger, touch your nose and go back and forth. Very good. Okay, thank you. With your hands, squeeze my fingers as hard as you can. No mercy. Very good. Okay, so now if I can go ahead and have you sit on the side of the bed here, I am going to test your deep tendon reflexes. And here we go. All right. And then right here. Okay. And then we're going to go on the back of the foot. All right. Very good. And very good. Okay. Any questions, any concerns today?
No, ma'am.
Okay, one more thing before we end our examination process.
Okay.
If I can have you stand up. I want you to face towards the bed. All right, and so what I want you to do, I want you to close your eyes and just stay standing. Very good. Keep your eyes shut, and I want you to stand on one leg. Very good. And then stand on your other leg, just one leg. Very good. Okay, this is going to be the hardest part. Can I have you hop on one leg, just 2 times? Okay, and then the other side. Very good. Okay, so now what I want you to do is I want you to walk that way. Just take about 3 or 4 steps. Just a regular walk.
A regular walk.
Uh-huh. Okay, and then turn around, and I want you to put heel to toe and walk back that same distance. Very good. Okay, you may have a seat. Any questions or concerns about today?
No, ma'am.
Okay, all right. Well, thank you for having me. Thank you for letting me examine you today.
You're welcome.
I
Thank
hope your
you,
blood
too.
pressure gets better and your asthma gets
Yes.
better. Definitely come back and see me whenever
Okay.
you have concerns.
Yes, ma'am.
Okay, all right. Thank you very much.
Thank you.
All right.